All right, we're going to start with chapter 28 now, which is PTSD. According to your exemplars, we were supposed to include PTSD in the anxiety disorders. With that being said, I do want to direct your attention back to chapter 27 and ask you to be sure to look at the Hamilton Anxiety Rating Scale. Now, why is that important? Because that is one of the most common scales being used in practice in terms of anxiety. So be familiar with that scale. That's a good one that they like to use on state board as far as scoring for mild, moderate, and anxiety. And that's in your book on page 561. In addition, I want to mention that all of the concept maps in your book are very helpful. I strongly encourage you to review those because what I like about the concept map, it gives you a situation, it pulls out the cues. And remember, using the clinical judgment model, those cues are the signs and symptoms, things that should be concerning. It also tells you a nursing diagnosis, but again, something else I like about it is the nursing action. And that's where you, as a nurse, take action in the clinical judgment model. So it gives you the nursing actions or the interventions, things that you should be doing for the patient. The last thing I like about the concept map is the outcomes. And of course, that's the last step in the clinical judgment model where you evaluate the outcomes. If something didn't work, you brainstorm and generate solutions to try something different. It also mentions medications in the concept map. So be sure to do those or review those. There are case studies, summary, and key points, review questions, and clinical judgment questions. I strongly encourage students to review those as well because oftentimes your mental health test does not look like your typical med-surg. So for some students, answering these questions might be somewhat challenging, okay? So please be sure to review that. So we're going to start with PTSD, and PTSD is going to be very short. We're coming from chapter 28, and that's page 578. So DSM 5TR is where the diagnostic criteria comes from to be diagnosed with PTSD. About 60% of men and 50% of women are exposed to a traumatic event in their lifetime. Women are more likely to experience sexual assault and child sexual abuse, whereas when we look at men, they're more likely to experience some type of accident, physical abuse, or combat, or witness death or injury. Although their exposure to trauma is high, the National Center for PTSD reports that about a little less than 10% of trauma victims develop PTSD. So, our DSM 5TR criteria says that trauma oftentimes precedes PTSD. There's an event that is outside the range of a human experience. It could be rape, war, physical attack, torture, or a natural or a man-made disaster. Right now I'm thinking about the people in Florida who just lost their homes. Several individuals lost their homes. Several people died from that incident. It tells us here that more than half of all individuals will experience a traumatic event. And again, less than 10% of those will develop PTSD. PTSD, as mentioned before, is more common in women than in men. So, PTSD is described as a multi system response and it's triggered by extremely traumatic events. These symptoms are not related to common experiences such as uncomplicated bereavement, marital conflict, or chronic illnesses, but they're oftentimes associated with events that are more markedly distressing to almost anyone. The individual may experience or witness a trauma alone or in the presence of others. So, again, some of those things, those extreme traumatic events, are listed here on this slide. So, what are the characteristics of PTSD? Re-experiencing the traumatic event or reliving it is oftentimes what you may hear it called. These individuals sustain a high level of anxiety or arousal. Some of them may describe it as a general numbing of responsiveness. Intrusive recollections or nightmares, not being able to sleep at night, reliving the event. Amnesia to certain aspects of the trauma. They can't recall what happened. They may experience depression, survivor's guilt. If somebody was killed and they survived, they may experience survivor's guilt. Substance abuse, anger and aggression, as well as relationship problems. Other symptoms may begin within the first 3 months after the trauma. They may have full symptoms pictures where they may have symptoms for more than 1 month and cause significant interference with their social, occupational, and other areas of functioning. So the full symptom picture must be present for more than 1 month, and it must cause interference again with their social life, occupational life, or other areas of functioning. This disorder can occur at any age, and the symptoms may begin within the first 3 months after the trauma, or there may be a delay for several months or even years. So, what I like to tell students is to turn to box 28-1 in your book. So 28-1 is on page 581, and it gives you the diagnostic criteria for PTSD. I would strongly encourage you to review over that and be familiar with it, okay? So, there's also a care plan in your book on page 588, and I like the one that's on 585. When it comes to planning and implementing for post-traumatic trauma or post-traumatic syndrome, look on page 584. It tells you that you need to establish some goals, and again, those can be long-term or short-term goals. When we look at that care plan on page 585, it tells us that we want to assign this individual to one staff if possible. Use a non-threatening, matter-of-fact but friendly approach. You want to respect the patient wishes, especially if they're of the opposite sex. Be consistent. They dislike when you make promises and you don't keep them. You want to stay with the patient during periods of flashbacks or nightmares. Obtain an accurate history. Sometimes it's good to get other family members involved who can help with that information. We do want to encourage them to talk about the trauma at their own pace and discuss some coping strategies that they plan to use in response to the traumatic event. We want them to be able to identify maladaptive coping strategies. Some people like to resort to substance and practice adaptive coping strategies. We want them to utilize or practice adaptive coping strategies. We want to assist the patient to try to comprehend the trauma if possible and discuss their feelings of vulnerability. So again, this care plan is outlined. I think it starts on 584 and goes to 586. And then there's a great concept map. Remember, I just mentioned that for PTSD on page 588 in your book. And I'm going to say it again. It helps you to recognize cues. And what are the cues for PTSD? Flashback, intrusive recollections, nightmares, numbness, amnesia. It could be irritability, explosiveness, self-destruction, substance abuse, or survivor's guilt. So, this individual could be dealing with some type of grieving, or they could be dealing with the post-traumatic syndrome. Either way, nursing actions are identified, and those nursing actions is where you, the nurse, do what? That's where you take action. Taking action for PTSD is what? Accepting the patient, establishing trust, staying with them during flashbacks, encouraging verbalization about what happened, discuss coping strategies, and assist the patient to comprehend how to deal with the trauma. Nursing actions for complicated grieving. If they're having a survivor's guilt, what are those nursing actions? They're outlined in your book on page 588. Please review them. It gives us a medicine here. Paroxetine, 20 milligrams every morning. So let's look at the outcomes for the post-traumatic syndrome. We want them to be able to discuss the trauma without experiencing any panic. We want them to have fewer or less flashbacks and nightmares. And we want to see if they can sleep without medication and as well if they can demonstrate the use of adaptive coping strategies. Again, I really like the care plan that's on page 588 in your book, and I encourage you to review it and use it for PTSD. Now, PTSD is short, and I will be uploading a little ticket to class to make sure you understand this concept.